Garlic is a favorite in kitchens across America, loved for its bold flavor and powerful health benefits, rich in compounds like allicin. It supports heart health, circulation, immunity, and more, earning its place as a true superfood. But garlic isn't risk-free. For older adults, especially those on medication or with chronic conditions, misuse can sometimes lead to serious health problems. Experts at St. Patrick's Medical Center highlight 6 common but dangerous mistakes with garlic. Knowing them can help you enjoy its benefits safely. Blunder number 6. Storing chopped garlic and oil improperly. Imagine making spaghetti and storing leftover chopped garlic and olive oil on the counter. It looks convenient, but this creates the perfect environment for Clostridium botulinum, the bacterium that causes botulism, a rare but potentially fatal food poisoning. Symptoms include blurred vision, muscle weakness, trouble swallowing, and even paralysis. To stay safe, refrigerate garlic and oil mixtures right away. Use within 3 to 5 days. Discard anything left out for more than 2 hours. For longer storage, freeze in small portions. It may feel wasteful to throw it out, but with botulism, safety always comes first. Blunder number 5. Combining garlic with diabetes medications. Garlic is widely recognized as a natural way to support healthy blood sugar levels. Research has shown that it may enhance insulin sensitivity and help lower glucose levels in people with type 2 diabetes. For many Americans living with diabetes, which affects about 38 million people nationwide, this sounds like a great natural ally. But here's the catch: if you're already taking medications such as metformin, sulfonylureas, or insulin injections, adding large amounts of garlic can create a dangerous situation because garlic itself lowers blood sugar. Combining it with medication can sometimes cause hypoglycemia, a condition where blood sugar drops to dangerously low levels. Hypoglycemia symptoms include sweating, dizziness, shaking, heart palpitations, blurred vision, and confusion. In extreme cases, it can cause seizures, unconsciousness, or even be life-threatening. For example, a patient at St. Patrick's Medical Center who increased his garlic supplement intake without consulting his doctor experienced repeated episodes of hypoglycemia. He thought he was simply eating healthier, but in reality, the combination of supplements and medication was pushing his glucose dangerously low. If you have diabetes, always monitor your blood glucose levels closely when introducing garlic or garlic supplements. Avoid large or sudden increases in garlic consumption. Speak with your doctor before taking concentrated garlic capsules or extracts. Garlic can still be beneficial for people with diabetes, but it must be used carefully and with medical supervision to avoid serious risks. Blunder number 4. Eating raw garlic on an empty stomach. Many people eat raw garlic on an empty stomach, believing it detoxifies the body and boosts immunity. But this habit can be harsh and even dangerous. Robert, a retired postal worker, tried it daily and soon developed severe stomach pain and nausea. Doctors found it worsened his gastritis. Raw garlic's sulfur compounds, like allicin, provide health benefits but can also irritate the stomach and intestines. For those with ulcers, gastritis, acid reflux, or bowel disease, it may trigger bleeding or serious flare-ups. Tips for safer garlic consumption: always consume garlic with food to buffer its effects. Cook garlic gently. Roasting or sautéing reduces its harshness without destroying all its beneficial compounds. If you prefer raw garlic, try mixing it into a salad dressing, salsa, or dip, so it's not directly hitting an empty stomach. Garlic can still provide health benefits, but the way you consume it makes a huge difference. Blunder number 3. Taking garlic supplements before surgery. Garlic supplements are extremely popular in the United States. From capsules filled with aged garlic, extract to concentrated oils, many people use them to support heart health, lower cholesterol, and improve circulation. However, few people realize that taking garlic supplements before surgery can be risky, even life-threatening. Consider Marcus, a 67-year-old gardener from the suburbs of Stonebridge. A week before his scheduled knee replacement surgery, his surgeon reviewed his supplement list. To Marcus's surprise, he was told to stop taking garlic capsules immediately. The reason? Garlic has powerful anticoagulant properties, meaning it acts as a natural blood thinner. In normal situations, this can support heart health by reducing the risk of clots. But before surgery, it increases the risk of excessive bleeding. Even small surgical procedures, like dental extractions, can become dangerous if the blood does not clot properly. Medical guidelines generally recommend stopping garlic supplements at least 7 to 10 days before surgery. Always disclose your full supplement list to your doctor or surgeon. Even if you think the supplements are natural or harmless, what seems like a healthy habit could complicate your surgery and recovery. Blunder number 2. Consuming excessive amounts of raw garlic. All know the saying, too much of a good thing. When it comes to garlic, this phrase couldn't be truer. Eating 1 or 2 cloves of raw garlic per day may provide health benefits, but some individuals take this to the extreme, consuming 10, 12, or even 20 cloves per day in hopes of supercharging their health. At St. Patrick's Medical Center, doctors treated a patient who developed chemical burns in his esophagus after swallowing large amounts of raw garlic daily. In another rare case, excessive garlic consumption led to hemolytic anemia, a condition where red blood cells are destroyed faster than the body can replace them. Excessive garlic can also lead to severe digestive upset, nausea, diarrhea, bloating, bad breath and body odor that doesn't wash off easily, skin rashes or allergic reactions, interference with certain medications. As with most things, moderation is key. 2 to 3 cloves of garlic per day are plenty for most people. More than that not only adds little extra benefit, but also greatly increases the risk of side effects. Blunder number 1. Mixing garlic with blood-thinning medications. A most dangerous garlic mistake is mixing it with blood-thinning medications. Garlic naturally thins the blood, and when combined with drugs like warfarin, Eliquis, or Plavix, it can trigger uncontrolled bleeding. Isabella, 72, learned this the hard way after taking garlic supplements alongside her prescription, which led to internal bleeding and emergency care. If you're on blood thinners, avoid garlic supplements unless approved by your doctor. Stick to normal food amounts and report any unusual bleeding right away. What seems harmless can quickly become life-threatening. Using garlic safely. Practical tips. Despite these dangers, garlic remains a fantastic ingredient with many proven health benefits. The key is knowing how to use it safely. Here are a few tips recommended by nutritionists and culinary experts. Crush garlic and wait 10 minutes before cooking. This allows the compound allicin to form, boosting its health benefits. Use gentle heat. High heat can destroy allicin. Sauté garlic on medium heat instead of burning it. Mix raw garlic with food. Add minced garlic to salads, guacamole, or yogurt-based dips to soften its impact on your stomach. Start small. If you're new to garlic or have digestive issues, begin with half a clove and gradually increase. Consult your doctor, especially if you take medications for diabetes, blood pressure, or clotting. Final thoughts. Garlic is both a kitchen favorite and a natural health booster, but it must be used wisely, especially for seniors who may face higher risks. From botulism in garlic oil mixtures to dangerous drug interactions, the consequences can be serious. With moderation, safe handling, and medical guidance, garlic can still add flavor and health benefits to your meals. A little knowledge is all it takes to enjoy this powerful ingredient safely.